Welcome back to the show. It is Medical Monday. May 15th is Kangaroo Care Awareness Day. And you may be asking, what is that? Well, today we'll be talking about the importance of this care, especially in the NICU. We welcome to the show this morning Samantha Volway along with Amber Arkles from Hurley Medical Center. Good morning.
Good morning. Good morning.
Yeah, well, quickly tell our viewers at home, what is it that each of you do?
I am the clinical coordinator at our NICU at Hurley Medical Center.
And what about you, Samantha?
I am the occupational therapist for the NICU.
Well, you know, it is interesting to hear the term kangaroo care. Maybe folks aren't too familiar with that. How does that even apply to what you do every day?
So kangaroo care was originated back in 1970 in Colombia. They had some increased infant mortality rates and low on incubators. So they decided to implement this kangaroo care to help with that. It's where they place baby against mom or dad's chest.
So skin to skin.
Skin to skin, yep. And it has so many benefits, and it just, the more research that we've had, it just comes to show that there's many long-term benefits all the way through the infancy period into the adulthood.
All right, so it makes sense now that we've established it's like little Joey clinging to mommy kangaroo,
Yes,
right?
yep.
Well, let's kind of dive into some of those benefits. How does this not only benefit the baby, but also just the family as a whole?
So leaving a baby in the NICU and going home, there's a component of stress and depression that can come with that. And so when you are doing skin to skin with baby, there's a 25% decrease in depression and anxiety. So there's that component as well. Also, it increases the confidence for mom or dad to care for their baby and get to know their baby despite having them in the NICU. And it carries on until they leave.
Okay, well, and obviously too, is this just a basic form of bonding as well? Talk about how it increases that bond.
Yes, so being in the NICU can be extremely stressful on both the baby and the family. So having those moms feel empowered to be part of their care is huge. So making sure that these families know that they are able to put their baby skin to skin, and all the improvements of such as vital sign regulation, temperature regulation, it will help produce mom's milk supply and increase breastfeeding success rates.
So a lot of things happen at once.
Yes.
And you know, again, back to being in the NICU specifically, how does this help baby in the long run as far as recovery and getting better day by day?
So our team rounds on each patient daily, and so we're looking at weight gain and growth, vital signs, and so kangaroo care, skin to skin, shows that they gain weight quicker. It stabilizes breathing. On mom's chest, it regulates their temperature better, and overall it leads to an earlier discharge.
Well, and how does that make you feel in your field just to see those successes and something as simple as skin to skin making a difference?
Yes, it is so rewarding just to see these babies be born so little and having the families be so involved in preparing those families for such a safe discharge and for a healthy baby.
Oh, wonderful. And what do you get out of educating families? Again, this is a simple thing, but it seems like it makes a big difference.
Yeah, you take this little tiny human being and this vulnerable mother or father, and you foster that relationship and carry them through that journey.
Oh, that's wonderful.
Very rewarding.
Well, thank you both for what you do, and thanks for filling us in this morning on the importance of kangaroo care.
Yes.
It's kind of fun to say too. Yeah. Thank you for coming in.
Thank you for having
Thanks
us.
so much.
All right, now